Well, Dr. Anderson, it's good to see you today.
You too. I appreciate it.
Yeah. So we went to rounds this morning, and you did a great job. You're just so knowledgeable about what you know and what you can present with your patients and other doctors, and we appreciate that. I'm glad that you're keeping up with the newest and latest technologies so that we can be on the forefront of this medical journey that we're on. So what are you doing to like keep up with all these things?
Yeah, I kind of made a decision when I was in training. The cool thing about being a resident, there's not many cool things about being a resident, but one of them that's neat is you get to work with a lot of different physicians. I think there was 17 or so neurosurgeons on staff at Penn State, and you got to experience them, what it was like with each one of them. And I got to see people who kind of were doing the same thing the same way for 30 years. And I got to see the people who were always kind of looking to innovate or looking for new ways of doing things. And I just, kind of made a decision at that time that I wanted to be someone who was never caught off guard, who was never surprised by a technology or something like that if it applied to my patients. I always felt, man, if we were doing the same thing, in any other industry pretty much, if we weren't making adjustments or changes, then we were being left behind, right? And I never wanted to be obsolete. And so I've kind of maintained that through my practice. I want to know what's going on. If there's something new, most of the stuff that comes out, I don't think probably is, immediately the gold standard. I think most of those things come and go, and technologies fizzle out because there's something wrong with how they function or how they work. But in general, we are going to see improvements and progress. And so it may be 1 out of every 25 or 1 out of every 100 or however many devices. But I want to be keeping my ear to the ground and know what's coming so that if this is what's best for my patients, I can adopt it as soon as possible and help my patients right away rather than waiting and waiting. Even though a lot of what we've been doing, it works. And from the viewpoint of 10 years ago, it works well from 10 years ago. But it doesn't mean it's the best thing we have today. And so I always want to feel like the way I'm practicing is the best we have to offer today. And the only way to do that is to keep up with new technologies.
Yeah, and that's great. One thing I appreciate as a chiropractor is I get a lot of patients that come to me and want to know where to go with their care. And when we're collaborating together, I can come to you and say, hey, what's the newest technologies that are out there? What direction can I lead my patients into? Because we want to collaborate, right?
Yeah.
That's what it's all about.
Yeah.
There's so much siloed care in the United States, and if we can build those relationships together, we're going to go so much farther.
Yeah. I think it's pretty critical, and I hear from a lot of chiropractors where someone's had instrumentation placed or something, and it leaves you wondering, what can I do with this patient?
Right.
Is it safe for me to do it? They've had it in for 3 months, they've had it in for 3 years, they've had it in for 30 years. How does that change? And so I agree. I think the ability to collaborate makes a big difference because none of these things are in isolation. I don't get to put implants in a spine that looks messed up, make the spine look better, and then it just stays in that state. That patient is going to go live a life. That's not the only place where they might have pain. They might develop new pain somewhere else. It might be musculoskeletal, and they're going to need to have solutions for those things. So I think saying, well, I don't know, I have no idea, good luck kind of thing is, again, it's not serving the patient well. So I think we should always all be kind of having those conversations. I don't want to take care of every part of that patient's health because I'm not suited for that, right? I need to play my role. And who is suited for that is the overall healthcare community, which involves a lot of people. And if we're not functioning together as one, then we're missing the mark.
Yeah, and one thing I appreciated, like today, you went over some different technologies that you have been using. And in my practice as a biomechanical specialist, that helps me because I can go to my patients and say, this is what I can do. I know how these things work. And so I now have that specialty to go forward and treat in a better way because I'm working in collaboration with you.
Yeah.
So, yeah, I think it's great.
Yeah, I agree.